I chose to come to Henrico Doctors Hospital and use the midwives here because for me, when I thought about my birth experience, the reason I wanted to go as natural as possible was because I knew that when I felt my son in my arms for the first time, I really wanted it to be as unadulterated as possible. No medication, no grogginess from surgery if possible. And I understand that stuff is extremely important if it's life-saving or if the woman needs it. I mean, there's nothing wrong with it. But I just wanted for myself to have this beautiful moment of when I get to meet him. And then when I met Megan and Amber, I just felt really comfortable.
We met during her pregnancy and talked a lot about how the pregnancy was going and what she was doing to prepare, and about fears and frustrations, and tried to laugh about all of the things that happen during pregnancy that are hard and difficult. So she was trying to avoid pain medication if she could, but going beyond that, any type of induction or interference in the normal processes.
The beautiful thing about a midwife is that they make the room very intimate. It's mood, it's nice soft music, it's maybe two, but mostly just one other nurse with the midwife, and it's relaxing. She had me in the bed in a certain position, then we moved to the tub, and she said, all right, now move to this way, and this will help. So Megan was she was in there. I mean, she was in there, but she wasn't in my face. She gave me suggestions that would help. She was reassuring, she was supportive, cheering me on. At the end, it really felt like I was in the smallest, most comfortable, secure, safe environment, and I had the people around me who wanted it all to go well. The fact is, the body was built for this. And I don't think I would have felt so confident about it if I didn't have such a great midwife like I did with Megan. Because at the end of the day, your body just does it. It's incredibly strong, it's beautiful, its potential is unrealized. And when you go through labor, you see just what ends of the earth your body can take and still be healthy and safe. And it's really incredible.
And she did it, and she birthed her baby. The baby stayed skin to skin, and we tried to have that time completely undisturbed so that she could recover from the work of all of that labor and take the opportunity to bond with her new baby.
But then the nurse took us upstairs to the postpartum area, and there we spent the next 2 days and 2 nights with an incredible team of women who were so wonderful and nice and caring. They came to check in on me frequently. They asked if we needed anything. They took care of my son.
Postpartum, she had continued support from her birth team. She also had support from the postpartum nurses, from the lactation consultants, and her physicians from her practice came to visit her and give her guidance. The midwives added an additional component to that. We came and visited her to try and help normalize all of those new experiences that you have when you're meeting your baby for the first time and trying to figure out how to breastfeed and figure out what's normal and what sounds they make.
Ultimately, labor is just a short time. The postpartum is when that care really comes into place. The amazing thing I did not expect was that Megan would call, and she said, how are you doing? How are you settling in? How is the baby? How are you handling less sleep at night? It was just beyond anything I could have asked for, and it was so special, and it really helped me feel like, okay, I'm not alone. I can do this, and I am doing it, and I can confidently say I don't think I'd be doing it this smoothly if it weren't for Megan's help.